Another increasingly common claims are with temporomandibular joint. So this is the joint right in front of your ear, the jaw joint, and this is attached by muscles to the rest of the face. This is where you get pain when you've had a stressful day, when you're clenching and grinding your teeth. Now, this was an alleged assault. This chap was a singer, and they missed this break. So there were two issues here. One, the alleged assault, and two, this was missed. And this led to an abnormal bite, but worstly, difficulty in mouth opening. And this claim settled for £1 million because it affected future career earnings. There's increased interest in TMJ surgery, especially arthroscopy for facial pain. And the kind of cases I've come up, well, I've been instructed with are relating to inappropriate surgery, because a lot of jaw joint surgery, the management tends to be non-operative in the first place, but there is a trend to jumping in and doing arthroscopies that may complicate issues. These patients can be complex with regional pain syndrome, and they present with headaches and migraines, and they're not really investigated appropriately. People jump in and decide to operate on the jaw joint. And you can, if I just go back one, this is a disc in between, and people tend to do surgery to reposition the disc as opposed to addressing all the other issues. Now, disc repositioning is very susceptible to relapse, and people come in complaining a year later that their symptoms haven't settled, and you request MRI imaging, and they show that actually whatever surgery they've had has relapsed, but they're not warned about it. So it's a consent issue. I've had cases where, because of several of these arthroplasties, where you put a scope in the joint and you can, for example, reposition the disc, there's been a lot of scarring, and they've had chronic pain, and so they've become accustomed to opiate use, and they've basically, the pain complex has become a chronic pain issue, not one to be taken lightly and even attempted to resolve with surgery, because of all the scarring of the soft tissues around the jaw joint. I've had one case where actually patient was unfortunately coerced into surgery, so to allow trainees to practice, because, as I said, this surgery is not common, but it's becoming more common, so people are very keen to get their hands on when they are trainees.